Let's speak English.
Let's speak English and forget about the camera. You just have a small chat with me and a discussion. The first question is about yourself. If you can describe first of all the center, the radiation oncology department, the staff who is working here.
We are one of the largest radiation oncology departments in Europe with 3 sites. And you can see one of these sites is Institut Curie in Paris, very close to the Museum of Curie, when Madame Curie worked for a lot of years. We have 5 accelerators and 2 tomotherapy in Curie Paris. We have also another hospital which is in close to Paris, and this is in Saint-Cloud, and there we have another 4 accelerators, large Hall CT scan, as in our department also, and we have the third part of our department situated in Orsay, when we have a machine of protons and a very modern machine, and also our radiobiology labs there. We are about 15 radiation oncologists in this huge department, full-time radiation oncologists. We have also our residents, and the head of department is Dr. Fourquier, and there are 3 different departments between protons in Orsay, photons and electrons René Guenin Hospital, and also in our department. We treat a lot of kind of tumors. Curie is pretty interested by the breast cancer, and it's recognized as a house of excellence in the breast cancer treatment. But we have also head and neck cancers, a lot of pediatric disease, very important department of ophthalmology, because we have also protons and brachytherapy. Prostatic cancer, also sarcomas and hematological malignancies. I think that we treat all kind of tumors. And as I said, we are trying to work in the clinical and also translational work, and therefore we work in a very good relationship with our 2 labs of radiobiology situated in Orsay. And yeah, we are trying to keep the tradition. Personally, I'm a radiation oncologist for 20 years now. I worked in MD Anderson Cancer Center as fellow in '94. Then I moved to France, and I worked for 8 years in University Hospital before to come in Curie Institute, where I'm for 10 years now. And I'm senior radiation oncologist involved in different kind of projects. And in this kind of projects, we discuss also tomotherapy use in especially in breast cancer and hematological malignancies, as well as association of new targeted treatments and radiotherapy. And I think that to do association of chemotherapy or new targeted treatments and radiotherapy, we need very sophisticated techniques, and therefore the tomotherapy machine is probably the best one to do this.
Perfect. So, where did you study?
It's I have very long history. I began 25 years ago in Bulgaria, in the National Oncology Center in Sofia, under the direction of Professor Mushmov, who was my first teacher, who was internationally known brachytherapist. And I realized my residency program initially in Bulgaria. I finished my specialty in 1992. Then I moved to Grey Lab in England, to finish my radiobiology course under the direction of Judy Dennekamp, who was the chief of Gray Lab in Northwood. Then I had my fellowship for Houston, MD Anderson Cancer Center, and I spent some time in the Department of Prostatic Cancer, in the Department of Digestive System, Head and Neck Cancer, and Brachytherapy. And then I arrived in France 20 years ago. Obviously, in every country I finished, and I realized all examinations. Therefore, it's pretty rich history of professional history. And 2 years ago, I had the highest diploma in France, HDR. It means that I can have my PhD students. Therefore, yeah, pretty long, but this is the age in relationship with my age.
Excellent. Why and how did you think of working in a field of cancer treatments?
Oh, yeah, this is very long history also, because when I began my study of medicine, I wanted to be cardiologist, but at the end of my study in the medical academy in Sofia, one of my colleagues said, there is very interesting position of residency program, and it was a grant for 2 persons, and there were a lot of candidates. And I said, radiotherapy. I really don't know what it means, radiotherapy. And in Bulgaria it's different, as in France. When you decide what kind of residence you will do, you have to do your choice, and then you will stay for 5 years just in this department. And then you will continue to work in the same department. And I presented my candidature there, and I passed this examination, and I was the first. And then I began this radiotherapy treatment studying, and with the study of radiobiology, physics, and a lot of things, new things. And I said, okay, I will do this for 1 or 2 years, waiting for position of cardiologist. And then I think that I fall in love with radiotherapy, because it's about 80% physics, and you cannot joke, and everything it's so organized, and it's so clear that I decided to stay. And I finished my residency program in 2 specialties. It was radiotherapy and nuclear medicine. And then there was another specialty of medical oncology, to be able to prescribe chemotherapy treatment and to work in terms of associations. And this is pretty interesting also. And I'm doing this for 21 years now, after my residency program, therefore. Pretty old radiation oncologist. But I was a little baby when I began.
So with your 20 years of experience, what is, according to you, the most innovative breakthrough in the field of cancer treatment?
I think that this is a wonderful time for the oncology and different kind of treatments, because I began 20 years ago, and this kind of machine were impossible to have. At the same time, we were very good in the techniques, and we tried to do IMRT with brachytherapy, for example. This is something wonderful, this technical work and these wonderful machines we have. The other thing we have currently are the new targeted treatments, and we can adapt the cancer treatment for every patient, not just to do something, radiotherapy or chemotherapy or target treatment. we can do something as a strategy for every patient, and to do something, as we say in France, à la carte, for every patient. It means to do personal treatment. And this is the most important thing, and I think that this is the future of radiation oncology and medical oncology, and probably the best thing is to associate radiation oncology and medical oncology to obtain better results.
That's very good. Thank you for your testimonial. As you talked about outcome for patient, and you are a very good storyteller. Do you have a story you would like to share with us about how tomotherapy, for instance, changed the outcome of her patient treatment?
I think that tomotherapy is a very intelligent machine, and I like very much my tomotherapy machine. I know that it will be conclusion, but it's true that in everyday practice it's something very useful, because this is something as for the first time in my life, because I'm a medical doctor, I like very much everything about art, but I cannot do this. Therefore, with tomotherapy, I can do this sculpture, the isodosis, and follow the tumor and trying to spare the organs at risk. And this is very interesting. And if at the beginning I was not sure how to use this machine, and one of my first patients who was presented with pancreatic cancer asked me, "Doctor, I like very much to do some sport. I'm running every day about 10 kilometers. What do you think? Can I continue to do this?" Pancreatic cancer is pretty difficult to irradiate. Usually the patients are doing not very well, with a lot of nausea, vomiting, and some problems. And I said to him, "I'm not sure, but we'll try. We'll do some new treatment." And at the same time, it was in association with chemotherapy. I said, "But I'm not sure that you will continue to run 10 kilometers. And the radiotherapy was pretty well tolerated. And I didn't ask him during the radiotherapy, is he's still running? Just every week we discussed how he's doing. He said, "Oh, it's okay. I continue my activities. Everything is okay, no problems." And at the end of the treatment, he said to me, "Doctor, I continue to run every day." And this was something wonderful, because this is really the quality of life. And it's very important for patients in oncology, because the patients in the oncology are suffering of their disease. In some cases, the prognosis is pretty bad, and it's very important to control and to preserve the quality of life. And therefore, I think that with the tomotherapy, we can keep this quality of life. We have also a colleague of mine who has treated patient who didn't want to lose her hair, and she experienced with brain metastases, and the only possibility was to use the tomotherapy to save her hair, and we did this. Therefore, we have a lot of examples, and at the same time, this is machine we use for all type of localizations and tumors, and it works pretty well. Therefore, we are waiting, and we think that 2 tomotherapies are still not enough in our department, but we hope that one day we will have more tomotherapy machines.
Okay. In your opinion, what would be the 3 weaknesses of the tomotherapy system?
The first one is that we have some days our tomotherapy machine is broken, and we are pretty unhappy, and it arrives in a lot of departments, I think, probably because we have tomo from the old models, but This is pretty difficult to accept because, as I said to you, usually we use the tomotherapy for difficult patients, and therefore it's important to have something very, very open and useful, and we are trying to use this machine 12 hours per day because we have a lot of patients, and the patients are waiting to be treated at the tomotherapy. The second is probably the quality of images. I think that we can improve the quality of images, of control images. And obviously the third is the low dose, and this is the problem, and therefore we don't use the tomotherapy machine for the children in our institution, to keep children without low doses. In some cases we use it, but not in routine work.
And what would be the 3 strengths?
Oh, there are more than 3, obviously. The first is that we can really adapt the dose to the treatment volume and to decrease the dose at organ at risk. The second is that we can use this machine as also stereotactic machine. We can do large irradiation and also boost. The third one is that we can do tomotherapy for re-irradiation in heavily pretreated patients, especially in hematological diseases or in metastatic diseases. There are other. Can I continue or not? I think that also tomotherapy machine is something very useful because 100% of our head and neck cancers are treated at tomotherapy machine. A lot of our gynecological digestive cancers are treated at this machine, a lot of hematological malignancies. And the most important thing is that this is, for us as doctors, is a very optimistic machine, because more of the patients who are treated there are curative treatment, radical treatment. There are very beautiful machines, but usually used for palliative treatment. Tomotherapy is very, very useful for curative items, as for example head and neck cancers. We have never the problem of junctions of the fields. Therefore, we are trying to develop protocols in the breast cancer, different localizations and difficult irradiation of breast, and also bilateral breast cancer, lymph node irradiation. In this case, we can decrease the doses to the heart and to the lungs, and we are trying to develop protocols using tomotherapy, trying to develop protocols to spare breast irradiation in young patients treated for lymphoma. Currently, we use the tomotherapy machine for skin cancers, and usually we use electrons, but it's pretty easy to irradiate the initial localization of the tumor as well as the lymph node drainage with tomotherapy. Therefore, we use it for a lot of localizations, and we are trying to develop this more.
Excellent. In very short, in 3 adjectives, how would you describe the tomotherapy system?
Intelligent, genius, useful.
Easy?
Not very easy.
Not very easy. Okay.
But intelligent usually could be more complicated. But when everything is done, our delineation work, it's very easy. But at the same time, we have to prepare everything. Therefore, there is a lot of work if we want to use our tomo as we have to use it. I think that there is a lot of work.
Perfect. So this interview and this campaign is called I Love My Tomo. how would you like to conclude this interview?
I can say I love my tomo or j'adore ma tomothérapie. Ça va?
Très bien.
Mon anglais était un peu roué, hein, parce que je ne me suis pas préparée.